If you like grapefruit juice and you take certain medications, you might need to be careful. That's right, grapefruit juice, believe it or not, can actually cause changes in some enzymes and proteins in your body that can actually increase the amounts of certain medications you may be taking in your body or decrease the amounts of certain medications you're taking in your body. It's actually a big deal, and some other food substances can do this, but grapefruit juice is a classic one. Guys, I'm going to tell you which medications it can affect, but once again, it does this by affecting enzymes and proteins and things like that. If you are taking in too much grapefruit juice, drinking too much, if you're of a certain body habitus or body type, etc., and you're taking some of the medications I'm going to mention, you may actually run into problems. Let me give you the first one. Statin medications. Many people are on statins for cholesterol. Two in particular, simvastatin and atorvastatin. Actually, those two medications, the amount of those medications can actually be increased in your bloodstream if you are taking in certain amounts of grapefruit juice and you're of a certain body habitus, etc. Big deal, right? But there are other medications. There's also a blood pressure medication called nifedipine. That's the generic, but there are lots of brand names for that. Also, certain organ transplant medications for those patients who are organ transplant patients. But also, the next one is a medication I prescribe quite frequently. It's actually called Buspar. It's an anti-anxiety medication. This medication can be affected by too much grapefruit juice. But not only that, we have a couple more classes to go, and some of these are common. A steroid called budesonide. Some people who have Crohn's disease or ulcerative colitis may be taking that, can be affected by grapefruit juice. Also, an antiarrhythmic drug. That's a drug for the heart that sort of tries to help control the rhythm of the heart, called amiodarone, can absolutely be affected by grapefruit juice. And the last one is one you very well might be familiar with. That's fexofenadine, which is the generic name for Allegra, which so many people use for allergies. That one, by the way, that one actually can be lowered in the bloodstream by too much grapefruit juice. Because remember what I said is grapefruit juice can actually increase the amount of the drug you're taking in your bloodstream or decrease it depending on which mechanism of action it's using with that drug. This is super important. It really underscores, guys, why you've got to be honest and open with your doctor about your habits, your dietary habits, your health habits, and things like that. It's one of the reasons why I usually say everything in moderation, right? Because, if you're drinking grapefruit juice in moderation, the hope is that you wouldn't have too much trouble, but you still got to check this with your doctor and see if any of your medications could be affected by grapefruit juice, especially if you know that you drink grapefruit juice, okay? So keep this in mind, something you might not have known. I think it's super important. Just make sure you ask your doctor, talk to them. Let me know what you think. Let me know if you do this or if you've heard of this. Pass this video on to anyone you think it might be helpful for. Guys, I'm Dr. Jen Caudle. If you've not liked and followed my page, I invite you to do so. For those of you who send stars, I respond personally. On YouTube, please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. Oh, check out my website, drjencaudle.com for lots more offerings. Guys, I'll see you soon.